Giddy up. We are live. Perfect. Okay. Well, a few of you are here, so that's good. That's great. So, how was Christmas for you guys? Cody Smithson, I see you on there. I don't see who else is here. Does it give me a list? It's my first time doing a live stream, so I am a complete noob at this, man. So, I don't know if I can see a list of all the people that are on here, but perfect. So anyway, Merry Christmas to you all. Best of the new year. I just thought that I would come on here and just hang out for a little bit, and I would just chat and talk about myself. You guys can ask me whatever questions that you want. There are some questions that are in the chat or in the community post, but I'm going to just start looking through the questions here and see what you guys are asking. Oh, Demon King, yeah, midnight. Where are you at? What time is it here? 7 o'clock, 5 hours ahead. So you must be like in Australia or someplace like that, I would imagine. Merry Christmas. Yes, Merry Christmas to you all. Oh, Sarah, you are so kind. The racing world, I miss the racing world. Let me tell you that. I really, really, really want to get back to MotoGP if I can. That is my favorite, but I like a lot of the other things. I like a lot of the other motorsports. And it's just that I'm so freaking busy, man, that I don't have time to do all of that. Brian Tran says, what do you think about wheatgrass? So listen, Brian, man, I think about wheatgrass the same way I think about most other things, in that I'm not really a big supplement or, big additives type of person. I believe in eating things. I believe in eating whole foods, eating natural things that you cook yourself. So basically, when I'm buying food, I try to get things that have less than 5 ingredients, and I try to cook everything myself. So that's what I think of. Wheatgrass as a supplement, in and of itself, I suppose, is okay, but I don't think it's any kind of superfood, and I don't go out of my way to purchase it. You know what I'm saying? So that's my thoughts on that. Let me go through here. Oh my goodness, man. We got people from like New Zealand, the UK, Austria. Oh my goodness. You guys are too freaking kind. I am so grateful to all of you for consuming my content, because without you, I wouldn't be here. And to know that my content resonates with you guys is so amazing. Something that a lot of you don't know is that I was a high school teacher for a couple of years in my first 2 years of medical school before I was a physician. And I really, really enjoyed teaching. But that was a pit stop because I knew I wanted to go into medicine. And so once I'm in medicine now, I didn't really have the same opportunities to teach that I did prior to. And so I really miss that. And so for you guys, I call you the intern army, because you guys are like learning from the senior resident, chief resident, who will be myself. But I love the opportunity to teach you guys and to have you guys understand and learn about medicine, learn about anatomy, learn about surgery, all those things. And that's what I love. And so to know that you guys resonate with that, and to know that you guys appreciate my content, I think that is absolutely amazing. Okay, let me get back to the chat here. Have I ever worked or collaborated with a veterinary surgeon on a case? Great question, Naomi 824. I have not done that, although I have talked with a veterinarian about doing that at some point in the future. A lot of the stuff that we do is similar, and a lot of the instrumentation and the tools that we use are similar. And so much so that, for example, Arthrex, which is one of the main vendors that creates instrumentation and tools for orthopedic surgeons to use, they also create tools for veterinary surgeons to use. So, there are a lot of similarities, and I wouldn't mind doing that at some point in the future. Hey, Miss Triss, video suggestion, World's Strongest Man events. Listen, I'm already ahead of you. That's a great suggestion. If you look back at my catalog, there are a couple videos that I've done on strength or on lifting events, powerlifting and strongman. But I have on the podcast channel, I don't have it posted yet, but I have it done. I had a podcast interview with Malcolm Wolf, who is from New Zealand, who was at one time one of the world's strongest men. So I have that podcast recorded. I just have to get it formatted, and then I'm going to post that. I'm kind of looking to do a video to accompany that. So I'll talk about potentially strongman injuries or something like that. But I do have that, and I hear what you're saying. I will be posting something like that. So keep your eyes out for that. Terry, listen, Terry, are you a chiropractor? Terry Hayashi, I'm talking to you, brother. Should I go to a chiropractor? So listen, man, everybody thinks that I hate chiropractors, and that's not true. I don't hate chiropractors. I think that chiropractors are very good for a small subset of musculoskeletal issues. And I think that chiropractors are really good for treating acute pain and people who might otherwise not be able to move. But I think that's it. Okay. So I don't think that you can really extend it very much beyond that. I think that if a chiropractor is practicing evidence-based medicine, then I think that they are going to be pretty much similar to a physiotherapist, and you probably wouldn't be able to tell them that much apart. So, it's a bit of a loaded question. Should you go to a chiropractor? Well, it depends, right? If you are in an acute pain if you are in acute episode of low back pain, you are unable to move, and there is, you've tried everything else and nothing is effective, then in that setting, I think that it is okay to go to a chiropractor to get some assistance in moving. However, it should be a very short-term thing. You shouldn't have to go back for a long period of time. And any chiropractor that tells you that you need to go back for maintenance and you need to go back regularly, that's all bullshit. And you don't need to do that. That is them trying to keep themselves in work. And by me saying that, I am in no way saying that means you need to come to a physician or you need to come to a surgeon because we need to help you. On the contrary, most of the people who come to me for back pain do not need me. They do not need medication. They do not need surgery. They do not need any of that. They need education and they need exercise. That's what they need. And reassurance that they are not freaking broken. So do you need to go to a chiropractor? Depends. But for most people, it's not that they don't need a chiropractor. It's that they could do everything that is required without going to a chiropractor or without going to a surgeon. So, that it's a roundabout way of answering your question, but yeah, that there it is. Oh my goodness, Nathaniel, Tulsa, Oklahoma in the house. Welcome, man. Geez, man, this thing goes by way too fast. I think I'm going to need to get a moderator for this in the future. Okay. Have you treated someone with hypermobile joint disorder, hypermobile Ehlers-Danlos? If so, what do our MRIs look like? What would you do to help somebody with Achilles cramps? So a bunch of questions there. Have I treated somebody with that problem before? Yes, I have. I've treated people who have Ehlers-Danlos, and I've had to do ACL reconstruction on most people. It's a little bit challenging because, as you know, Ehlers-Danlos is a connective tissue disorder, and they have problems with their ligaments being more lax than is normal. So for those people, we try to treat those people if they have ligament problems. We try to treat those people non-operatively if we can, because if we take an autograft, meaning a graft from them, a tendon from somewhere else to recreate the ACL, it also has that crap collagen. And so although it may initially be tight and restore stability, oftentimes it starts to loosen over time. So that's a little bit of a problem. And for most people, I don't like to use allograft. So that means getting a donor graft or a donor tendon from a cadaver. There's lots of people who swear by it, but the studies show that if you use autograft in young people, it's shit. It does poorly in the long term. So I generally don't like to use it. There is one group of people, however, in which I will consider that, and that is people who have Ehlers-Danlos. And that's because their collagen is so crappy that even if you use an autograft, which is a tendon from them, odds are that the allograft will do better than the autograft that came from them. So that's one group of people that I will use that in. What do their MRIs look like? Their MRIs don't really look that much different because the changes that they have are at the molecular level, at the tissue level, or cellular level, I should say. So you wouldn't really see those changes unless you're looking under a microscope. So the general MRI itself, or the large scale MRI that I'm looking at, where I'm looking at the joint level, you're not really going to see much difference. And the final question, what would I do to help someone with Achilles cramps? Well, it really depends on why you're getting the cramps. But, if you rule out some of the simple things like electrolyte problems, which is quite common, if you have, abnormalities in your sodium or your potassium or your calcium, those are most common that would cause cramping. Then as long as those things are normal, then we have to start to look at, well, what are the mechanical issues that are contributing to the cramping? I.e., are your, is your gastrosoleus or your calf muscles, there are two, the gastroc and the soleus, are those tight? Are your hamstrings tight? Is your plantar fascia tight? Like what's going on? And Achilles cramps, that's often going to be associated with some level of tightness in that posterior chain. So those are the things that I would look at, and I would get people to work on that to address those problems. Apothecary Raynor, why thank you. Will there be any possibility for Primaris Space Marine videos? Of course there will, Cody, man. You know it. I have to say, I love the Space Marine videos. They are some of my favorite. You guys engage with them a lot, but they take a lot of work. Although prior to doing those videos, I had like a passing knowledge of the Space Marines, I didn't really know a lot of the lore that well, and I didn't really have an in-depth understanding. And so for me to do those videos and to do them to a level that I think is appropriate for all of the people like yourself who are really into it, it takes a lot of time, man. And for my staff and myself who are researching it, like, we want to give you the best product that we can. And so it really takes a lot of time to research those. So, considering that I'm a full-time orthopedic surgeon, my wife and I run a full-time business outside of this and outside of that. And then this is like my third full-time-ish job, then it just takes a lot of time. And so the short answer is yes. The long answer is I'm not exactly sure when, but I'm looking forward to doing that, to doing more stuff, going on to the orcs, going on to other chapters, and doing other things. So yes, it is coming. Let me see. So McCulver, I'm pretty sure that I watched a video of yours on the dangers of chiropractic adjustments, and coincidentally, I just saw a post on Twitter about someone who had a stroke from a carotid dissection. Yeah, no doubt, man. It's very hard for us to specifically say that it came from that adjustment, because usually there's a little bit of a time delay, and so that is the safety net that chiropractors use. They go, oh, well, I did the adjustment and they didn't stroke immediately thereafter, so it wasn't from us, it was pre-existing. But it's a scary thing, and I think there are lots of different ways for them to help people. And doing a spinal manipulation is not necessary. Studies don't show that it offers any additional benefit. So if you can do other things that are less risky and get the same result, why do that thing that potentially has a risk? Let me see here. Oh my goodness. Thank you very much. New member there. That is a long name. Lots of numbers, but thank you for the tip, and thank you for buying my staff thank you for buying them a coffee. Greatly appreciated, my man. All right. So how toxic are SSRIs to the liver? Listen, I am a physician, And you know, I am classically trained, and part of our training is in the use of various medications, of which SSRIs are one. Any medication that we have is generally a derivative of some natural compounds, but what they've tried to do is adjust that compound so that you don't have the other effects of anything that might be associated with it in nature, or they've tried to increase the effect of it. And so SSRIs are selective serotonin reuptake inhibitors. Those are a type of antidepressant which you know, have a number of effects. And potentially one of the effects that they can have is on the liver. And I have to say before speaking any further, that's not my area of expertise, right? Because I'm an orthopedic surgeon. But I will say this. So in the past, I have had some I had some issues with depression during my residency. And there was a point in time when I was on antidepressants for a period of time. And in fact, my depression, if anybody who's gone through residency, they can attest it's difficult at times. And when I went through, I had 3 kids, a wife who was trying to be a professional student in architecture. And we had no familial support in the city where we were at. Closest family was 500 kilometers away. So I was kind of depressed for a period of time. And so much so that I had to be on 2 antidepressants at the same time because one wasn't enough, one of which was an SSRI. And liver function was something that we monitored from time to time. And it was an issue of concern. So we kept an eye on it with blood work. But the choices were that or for me to unalive myself at the time. So, you know, when I consider the alternative, then, you know, the liver damage and me potentially monitoring that to make sure that it wasn't happening probably were better than what the alternative was. And I ended up being on antidepressants for a period of time. And then eventually I was able to get over my issues and sort of get my mind right. And, you know, that is past history. Once that was okay, I didn't have to take them anymore. And so that's something else to consider. So, you know, how toxic are they? Well, there is always an element of toxicity. But number one, you have to monitor your liver function, and considering that if you're a normal person, don't have any other issues, underlying issues that affect your liver, then that should be okay. And you potentially don't need to take them for life. So those are things to consider. What are the long-term effects of cannabis use on the cardiovascular system, specifically not smoking, but eating or vaping dry flower without combustion? My goal is to keep my stress to a minimum. So, well, obviously, with, again, not my area of expertise, but I'll talk about what I know. So one of the things that longtime smokers of cannabis will find is that they can eventually get COPD, or chronic obstructive pulmonary disease, because of all the inhalation over time has an effect on the small airways. And so they end up getting these problems, and they have difficulty breathing, and then eventually they may have to go on oxygen or other stuff. You know, they'll have to take steroids chronically and that kind of stuff. If you are not smoking it, then potentially you can avoid some of those issues. But vaping, to be honest, has quite a significant risk, because there are a lot of other carrier compounds that are used to create that vapor. And once you burn those compounds, even though you might have a sort of steam base or other type of vapor base that you're using to carry that THC, all of those burnt compounds will have an effect on the tissues of the lungs. And so, you know, in the short term, it may not be a big problem, but over the long term, that can have very detrimental effects to the lungs, and almost as bad, or sometimes in some cases even worse than with just smoking a joint. And this is actually something that we've been thinking about for a while, and I think we're going to do a video on vaping, not vaping cannabis in particular, but just about vaping in particular, because it seems with the push to change or to restrict or to get people off smoking, a lot of people, particularly millennials, are now vaping. And vaping has a lot of issues that are associated with it as well. So I think that's something that we need to educate, our viewers, our members on. And so that's something that we'll talk about then. And, obviously it's better for you to have something that does not involve combustion. But then again, you have to have something to carry that THC or those vapors into your lungs, and whatever is the carrier could also affect your lung tissue, and over the long term that could be a problem. So let's go on to the next one. Where are you from, Doc? I'm from the moon. Oh, canvas, born and raised. Lots of cheeses here. Nice. Well, so my heritage is Jamaican. But I am actually Canadian. I was born here in Canada. In my family, there were 6 kids, and I was number 4. So first 3 were born in Jamaica. My parents moved from Jamaica here to Canada. And then I was the oldest of the 3 children that were born in Canada. So I am Canadian through and through. Although some people think that I'm from, sometimes they can hear my Jamaican accent. And if you get me around other Jamaican people, then you'll hear a little bit more of it. All right, let me see. Genetic vaping chemicals can damage lungs. Yes, that's right. So for sure. Brian Tran, also love the background. Thanks, man. Listen, I don't want to show you my office right now because it is a disaster. All right. It is a huge mess. And you'll notice whenever I'm shooting my videos, I have a different lens on my camera. I'm shooting in this direction here, and I try not to show you all the mess because, oh my God, like I said, I'm freaking busy, and my office here looks like a whirlwind went through it. So that was my biggest fear actually about doing this live stream tonight, is that I was going to be using a different camera than I use when I film my videos. And so because of that, you're going to see my thing there. So now what happened here? Edit. Oh, somehow I lost my, what is going on here? What? Okay, somehow I have lost my stream here. What the hell? Okay, what is going on?